Hi everybody, I just wanted to introduce myself. So I'm Justine from Acre Pharmacy. We've got the lovely Dr. Brendan with us today, who's going to deep dive into polynucleotides and exosomes, which obviously is very much taking over the market currently. So if we just start tonight's session, I'll introduce you to Dr. Brendan, and if you have any questions along the way, please pop them in the chat and I can just direct those questions to Brendan for that time. And then yeah, hope you enjoy the session, everybody.
Great. Hi to everyone and good evening on this very cold Thursday evening. It's very dark outside, but I'm sure you guys have decided to learn a little bit more about polynucleotides, in particular the Nucleofill range and the BTEC serum, which has kind of transformed my clinical practice. So here we go. So a little thing about we'll be discussing today is about the molecular structures of polynucleotides, how they actually work on a cellular level, and also VTEC serum with synthetic exosomes, which I believe is the first in the world. And we can have a little Q&A as well. If any of you have any questions, as Justine mentioned, feel free to type in the chat box, and Justine can interrupt me at any time to just ask me any questions, yeah? A little bit about myself. I am a medical doctor. I'm an internal medical physician, part of the Royal College of Physicians, and I have founded my own clinic and medical director of Dr. BK Aesthetics Clinic. And a couple of my clinical kind of interests are also in research and also writing clinical papers as well. So polynucleotides or polydeoxyribonucleotides or PDRNs, what exactly are they? So they are chopped up little bits of our DNA, and using this kind of genetic information, we're able to trigger and activate cell membrane receptors, which can further stimulate second messengers to do what we want it to do. So you think about it like a key and a lock, where your polynucleotides are the key and your cell receptors are the lock. Different locks will open different doors, and they would trigger different mechanisms within a cell. And in the case of using polynucleotides in skincare, like Nucleofill, and injectable treatments, the main goal is always to stimulate collagen and elastin. Two words that you will hear me saying a lot tonight: collagen and elastin. So polynucleotides, where exactly can they work at? From the deep levels, the bone tissue and also the adipose tissue, looking at the dermal layer, looking where your fibroblast cells are sitting, and also hair, which we'll have a little chat about later as well. So the main areas which polynucleotides can work at are the dermal epidermal layer, the vascular level, and its effect on the deeper tissues such as the fat layer and also the bone as well. So a couple of things that we can think about when we are treating with polynucleotides and the effects that we can get. You get hydration, because polynucleotides itself can bind water and it's going to attract water into the area. And it's a little bit of hyaluronic acid as well, which is going to help stimulate that kind of hydrating effect as well. The antioxidant effect from the polynucleotides are going to help mop up any of those reactive oxygen species, free radicals that can, as we know, can break down the structures of collagen. Stimulating the fibroblast cells via the CD39 and CD40 receptors are going to very strongly stimulate the collagen and elastin production from the fibroblast cells. And this is why it's so key to use polynucleotides in patients who have really, really crepey skin, who have sagging skin. This is what's going to help to improve the quality of the skin. Not only does it increase the number of fibroblast cells, it increases the metabolic activity as well, which means fibroblast cells which are in the more dormant, more sleeping state is going to be woken up, and they're going to start producing more collagen and elastin. The other kind of cells which it helps to stimulate as well are to maintain healthy skin. So thinking about your extracellular matrix, your aminoglycan proteins and glycoproteins, those are going to help maintain the structures around the collagen fibers to ensure that your skin is nice and hydrated and nice and plump and juicy. So this is just a schematic on how it can stimulate fibroblast cells. As you can see, it's going to trigger your second messengers, causes a profibrotic gene expression, which will in turn cause collagen and elastin production. The gym, in fact, is something that's quite interesting, and this is essentially where your fibroblast cells mature into myofibroblast cells, which will in turn give that kind of lifting effect, especially in the lower face, where I do a lot of my treatments for huge number of my patients. These myofibroblast cells are extremely important in helping that tissue tension, which we kind of lose over time as we age. So the effects determine the improvement of the dermal epidermal layer, which will help improve the quality of your skin, reducing wrinkles, reducing the crepiness of the skin. And this essentially can not only be done in the face, think about your entire body where you lose a bit of the elasticity. This is where you can treat your patients with Nucleofill. At a vascular level, which is particularly important, especially in the periocular area and also your hair, is that it's going to increase the neovascularization. When you have increased blood flow, you're going to have an increased amount of nutrients and healthy blood that's going to the area to help the area proliferate. So if you do it under your eyes, you're going to help reduce the dark circles, improve blood circulation to the area. It's going to reduce the amount of edema and accumulations of the hemosiderin, which can stain the under eye area. Increased blood flow into the hair bulk is going to stimulate the production of hair. It's going to reduce hair loss as well. So in the deeper levels, as I mentioned earlier about injecting into the fat layer, it's going to help reduce lipolysis and increase the lipogenic effect. So think about it as we age, our facial fat pads will start to go south, it starts to move in, and that's where we get a lot of the sagging and changes that we see in the skin. What this does is that it's going to help to reposition the adipose tissue in the face, and it's going to help to maintain that healthy facial fat in the face, which is what you want. This is why also one of the reasons why I'm not a fan of things like buccal fat removals or even using any sort of lipolytic treatments, especially in the face. So as I mentioned earlier about the changes in our fat pads as we age, in the picture on the right, you can see that the fat pads are a lot smaller. They've gone downwards and gone south, which we want to help treat by using polynucleotide. You're going to help, obviously not reverse all the way down to how you were when you were in your 20s, but it's going to help to maintain and just gradually build up that amount of fat in the face. This is another quite a nice schematic of how the bones change as we age. You can see in the top photo here, the mandible has lost a lot of volume, and what happens to the skin that's over it? It's going to start to sag downwards because this underlying structure has become smaller. So using things like polynucleotides is going to help keep the amount of bone that's in the skin and in the bone, which is going to help provide that structure for your overlying tissues. As we mentioned quite briefly earlier about polynucleotides and hair, it not only increases the circulation in the hair, it also has a targeted action at a receptor level. So it acts as almost like a false layer for your androgens to bind onto the receptors. As we know, when you have androgenic alopecia, that's when the 5-DHT is going to bind onto your receptors in the scalp, which is going to cause hair loss. So by providing a false sublayer, the androgens are not going to be able to bind, which means that you are less susceptible to hair loss from that point of view. And it also helps improve the cellular energetic profile by enhancing enzymatic activity, such as aromatase, which will break down the androgen. So, a couple of real great techniques that that we can employ when we are doing polynucleotides. Obviously, it depends on your patients. So, the first one would be the 5-point technique, which is also known as the biorestructuring points, aka BAP. So, 5 points on each cheek, very safe areas. There aren't any important blood vessels, nerves, or lymphatic vessels in these areas. Very well tolerated. And for this area, I usually would recommend Nucleofill 20 or 25, depending on how your patient's skin is like. Very easy, well tolerated. It's the nucleophil comes in a 1.5 ml, so divide it by half is 0.75 for each side of the face, and you just put about 0.25 mils on each of the injections, or less, 0.15, sorry. You can also use a cannula to inject in the jowl and the pre-jowl area. You can also use a retrograde kind of technique when you're injecting with a needle if you don't wish to use a cannula in this area. But the cannula is quite a nice tool to have to reduce any sort of bruising or swelling, especially in this area here. This area here also in the jowl and pre-jowl area can be quite tender when you are injecting with a needle. So cannula can be quite nice to do as well. Not only can you use cannula in the lower face, when we talk about the periocular area, it's also quite a nice tool to use. The multi-injection technique is essentially using tiny little micro wheels and injecting it almost like a grid pattern is what I do a lot for a lot of my patients. Just drawing a little grid about 1 centimeter apart for each injection point, around 0.05 to 0.1 mil per injection point is usually quite a good idea. I would probably say if you're doing it for the entire neck, 1 syringe would be enough. If you're doing it for the neck and the décolletage, and when you have these vertical lines that a lot of the sun worshipping people might have, then you need about 2 syringes of nucleophil. This technique is also fine to do on the face as well. In the periocular area, you can actually bring it all the way up to the eyebrow as well. It's going to people who are losing hair in the eyebrow because of how it helps to stimulate hair growth as well, can see that the eyebrow will start growing as well. And you can see that you can actually go really up quite close into almost the lash line. And I like to also bring it up into the temples as well, because we need to treat the entire periocular area as a whole. We'll talk a little bit about the protocols and how often you need to do it in a second. So the micropomphis technique, which is the little injection wheels, as I mentioned earlier, about 0.05 to a 0.1 mil. You can do about half to 1 centimeter apart. That's totally fine. And the protocol that's recommended, 2 sessions 2 weeks apart, and then 2 sessions 3 weeks apart, and then a maintenance session about once every 3 months or so. In my clinical practice, though, after 2 or 3 treatments, people can start to see a result, and they're more likely to come back for the 4th treatment and the maintenance treatments after. I was mentioning a little bit about the cannula in the periocular area and Nucleofill eyes, which is quite a nice one to use around the eyes. It's very, very easily done. Just 1 injection hole, popping in the cannula and filling up each area with about 0.75 mils. It's going to give a really beautiful result. Using a cannula in the periocular area is also going to reduce your risk of bruising and swelling. I offer both ways under the eye, both the microwheel injection bits and also the cannula. And using the needle is going to increase your risk of bruising because of how vascular the area is. Mentioned earlier about using a linear retrograde technique with a cannula and or a needle also can be used. Again, 2 sessions, 2 weeks apart, and then 2 sessions, 3 weeks apart, and then a treatment once every 3 months is a really good idea to maintain the collagen and elastin production and keeping it really nice and high. In the scalp, we use the microbial injections, and you can not only do it in on the crown, also in the hairline. Just be mindful that it can be quite sore in the scalp, so always warn your patients. And also because the skin is so thin, it's very important to always warn your patients about this. And using any kind of numbing cream in the scalp can be quite a messy job altogether. Remember, I mentioned a little bit about using the Nucleofill around the eyebrow as well. This is where you can inject your Nucleofill as well. So as I mentioned, in the scalp, this protocol is a little bit different. You do 2 sessions 1 week apart, and then 2 sessions 2 weeks apart, and then a session every 2 months. So 2, 2, 2. There's a couple of before and afters, which I think are quite important and quite nice to see. What do they actually do? You can see in this patient the lightening of her nasolabial lines. She's got a nice lift and she's got a nice glow to the skin as well, which Nucleofill will give you. With increased kind of collagen and elastin, the skin is just a bit more juicy. Remember, the extracellular matrix, it becomes thicker as well. It's going to support the collagen production, and it's going to help support your collagen fibers, which is going to give you a more youthful look. And just have a low look at her jowling here as well. I mean, pretty impressive just after 6 sessions, about 2 weeks apart. Again, here you can really see the nasolabial lines. Even her cheek looks fuller and lifted, which is pretty impressive. The neck, which is a notoriously difficult area to treat, you can see the creepiness of the neck is improved just after 2 sessions. And the neck is one of the treatments I offer a lot, especially when it comes to the winter months, because people can wear turtlenecks. And in this picture, you can see the fine lines over here have much improved, and even her jowls as well, and the lightening of the nasolabial lines. Remember, I talked about the myofibroblast cells, which has the increased tension that's going to help to lift the skin as well.
Brendan, I've got a question here for you.
Sure.
So thank you very much. This is from Hajra. I have a few patients asking if polynucleotides increase facial hair or cause it to grow back if previously removed. I have never had a patient with this clinically. What are your thoughts? As they help eyebrows, I would imagine facial hair theoretically could return.
I think, yes, theoretically it can, but remember that facial hair is mostly non-terminal hair. So I think this kind of stimulation of your terminal hair and facial hair are going to be quite different in the way they grow and the way it gets stimulated by polynucleotides. It's going to be quite different. I've never had an issue with anyone coming to me with increased facial hair growth after polynucleotides. I've been using it for a good almost like two years or so now.
Fab, thank you.
Thank you. And this photo, you can see the improvement of not only the darkness, but also the eye bags look a lot better just after 4 sessions. I do have a couple of quite nice before and after photos on my Instagram as well, and of one of my patients, a black girl, and you can see the eye bag has kind of just moved back into place, if you like. And this is what you can kind of expect, a little bit of swelling just right after the injection with the cannula. It's almost like injecting a teardrop filler, a kind of similar technique. And this, I appreciate the colors a bit different, but you can see that they also treated the eyelids as well. And you can see in the third photo, the eyelids, the creepiness here is much improved. And also the eye bags, the creepiness under the eyes, the lines under the eyes, compared from the first photo to the last photos are also really improved. And in the hair, you can see a much increased density and thickness and volume of the hair. And this is with polynucleotides and also with a hair transplant. After 4 sessions, you can see it's much more dense, which is great. So there are a couple of types of nucleofill that are on the market. You've got eyes, as I have here. You've got hair, which I don't have on hand, 20 and 25, and also nucleofill H, which is essentially a larger syringe of nucleofill 25. So nucleofill eyes has 2 mils of product, and it has a slightly lower molecular weight, so it's a bit more less viscous, and it's going to be less painful when injecting for your patients. As I mentioned earlier, either with tiny little injections, you can use a 30 gauge 4mm or 7mm needle, or you can use a cannula as well. And then you've got the hair, which has 2% of polynucleotides in there, slightly higher molecular weight, and this is why it can be a little bit stingy when you do it for patients. Just be mindful of that. Also, it contains 2 mils in the syringe as well. So you've got 20, 25, and H. 20 is my wonder drug, if you like. It's very versatile. You can use it pretty much everywhere. It's got, again, 2% in 1.5 mils, which is quite a high dose of polynucleotides. And this one is very well tolerated by most patients. You also have 25, which is a slightly higher percentage, 2.5% in 1.5 mils. A little bit, in my experience, a little bit more viscous. It has a 48 to 65 pascals. And this one is more suitable for slightly deeper injections because it can be quite tender when you're pushing. H, as I mentioned, is just essentially nucleofill 25, but in a 2 mil syringe. So indications in the periocular area, as I mentioned, eye bags, wrinkles, helping to redensify the crepey tissues, and it helps to move and improve the look of the eye bags, helps with superficial wrinkles, and is particularly fantastic for pre and post-surgical treatments. I have quite a few patients who are pre and post blepharoplasties. So pre blepharoplasties, I would do it probably about 3 to 4 weeks pre-surgery, and for post-surgery, about 4 weeks or when the plastic surgeon gives the okay. 20 is for patients who have starting signs of aging. Obviously going to help with your collagen stimulation, helps the moisturization, helps with the free radical acquisition. It's going to help with small little depressed scars as well, and it's my choice pre-surgery and post-surgery as well. 25 and H are for patients who have more serious kind of signs of aging, and as I mentioned, a little bit better for slightly deeper injections, so dip dermis, adipose tissue, and also bone tissue. And if your patients have a lot of sagging and complaints of jowls and the pre-jowl area, this is where you can inject in the lower face with 25. You can use a cannula or a 4mm, 30 gauge 7mm needle in this area as well. So we're going to move on. Has anyone got any questions about nucleofill so far? If not, we can move swiftly on to exosomes.
I can't see any in the chat at the moment. I have activated everybody's microphones as well if you have got questions, so you can just shout up if need to be.
Well, if no one has any questions, we can move on swiftly to VTech serum. So VTech serum is an innovation. It's the first one kind of exosomes that are synthetic exosomes with encapsulated polynucleotides and also peptides. So what exactly are exosomes? You know, this word has been thrown around so many in not only the aesthetics industry, in oncology, and also in medicine, clinical medicine as a whole. Exosomes are essentially tiny little vesicles, okay, that your cells secrete to communicate with each other. So think about it like your WhatsApp. It's a little message that each cell sends to the other, and each what they contain is variable. A very common question that a lot of people have is, do exosomes cause cancer? Yes and no. Cancer cells secrete cancer exosomes, which would lead to cancer. If your exosomes are from a healthy cell, it's not going to cause cancer. I hope that makes sense. So exosomes can contain things like proteins, polynucleotides, messenger RNAs, and also your binding molecules, HLA class 1 and 2, which would bind their respective cells which have the antigens. So one of the important things that we don't ever use are human exosomes, as it can present very dangerous membrane antigens, which can then cause a very violent immune reaction. And this is also seen in things like kidney transplants, for example, where they can get really, really sick. So a little nice comparison of the differences between human, vegetable, and synthetic exosomes. Quite a busy slide, but what I want you guys to really take away is how synthetic exosomes are just much safer because they are man-made. You don't have any sort of antigens or transmembrane proteins. Your body is not going to be like, oh no, there's something foreign, let's go attack it with your immune system. It doesn't have any disease because it's all controlled in the lab. And one of the most and best things about synthetic exosomes is that it doesn't have any special storage conditions. I've used vegetable exosomes in the past, and it has always to be kept on ice, and it's quite stringent temperature requirements. Having VTech, which I have right here, portable, easy. You don't have to store it in special areas or in the fridge. So what are the advantages of using synthetic exosomes? It protects your contents from enzymes, from breaking it down. It helps to make sure that whatever you want in your exosomes are released at the receptor structures at the surface, which means you get greater receptor stimulation. So using less product to get an even better result. What's not to love? So VTech comes in a beautiful gold box. It's got 3 vials of 5 mils. I only have 2 here because I've already used one. And each patient would have about 2 mils per area which you're treating. So about 2 mils for the face, 2 mils for the neck, and so on and so forth. So what exactly is in VTech serum? You've got 2% of polynucleotides, which is 20 milligrams per mil. You have your biomimetic peptides, which are oligopeptide 20 and acetyl decapeptide 3, and also plant stem cells. Using microneedling device such as you've got like your derma pen, your skin pen, 2 mils of the VTech serum onto the entire face, and using that as a glide. I tend to put on a little bit of the serum, use it as a glide, microneedle it in, and then pop on a little bit more to ensure proper absorption. It's usually quite it will be my choice. How deep you go is really dependent on how severe your patients are. If you have quite healthy skin, I would probably recommend 0.5 to 0.75, maybe up to even 1 millimeter if they have a little bit of open pores or that's what you want to treat. However, be very mindful if you're treating the periocular area and also the forehead. These places are very, very sensitive. So I would recommend about 0.25 to 0.3, just around the periocular and the forehead. You can obviously also spot treat. For example, if they've got a scar on the forehead, just use a slightly deeper setting on that scar with the VTech serum, and that should be fine. The application protocol with microneedling and VTAC is 1 session every 2 weeks for 4 to 6 sessions, and then repeating this every 2 cycles a year, so once every 6 months. I do have some patients who do come in every month for this treatment, and it makes the skin glow. I'll show you a couple of before and after photos later, and yeah, people just keep coming back for more exosomes. As I mentioned, 4 sessions, 2 weeks apart, and then a session every 2 months, or you can do it twice a year. Or like me, once a month. There's some quite nice before and after photos. Look at the quality of the skin. I do realize the color is a bit different, but just look at the pores. Look at the nasolabial lines. Much improved. And even scars as well. You can see the scar on the right in the after photo. It's not as raised. Color started to diffuse. And this again, just ignore the drawings, but you can see the quality of the skin is much improved as well. Even here on the right, she looks like she had a nice, good night's sleep. She looks more hydrated and rejuvenated. And even the pigment is starting to get lighter as well. And that was it. Another thing that I wanted to also mention quickly about the application with microneedling, if any of you do offer things like Morpheus or CO2 lasers in clinic, this is a nice one that you can use as an add-on after the treatment. So I do a lot of Morpheus in clinic, and usually after my Morpheus treatment, I will pop on some exosomes just to help calm the skin, to help. And since you've got lots of open needle channels, you might as well pop on lots of great serums and great ingredients that are going to go deep into the skin layer, into the fibroblast cells, to stimulate your collagen and elastin production. Yeah, so that's my recommendation. The VTAC serum can not only be used on the face and neck, hands, it can also be used on the scalp for hair growth as well, using the same kind of technology with the polynucleotides and the same ways that the polynucleotides would stimulate blood circulation in the scalp to reduce hair loss. This can also be done in the hair. And that was it. Has anyone got any questions at all that I can answer whilst we're here? I see how someone's typing, so. Oh, you're welcome. Anyone have any questions at all?
Simone is just typing at the moment.
Sure.
So just to round it up from me as well, so we have VTAC serum and also Nucleofill at Acre Pharmacy. We are one of the preferred suppliers for Promoitalia. So I mean, Nucleofill ranges from about £40 to £50 per box, and then we've got the VTAC serum that retails at £115 currently. We can obviously then link you up with Promoitalia for further training if needed, but please get in touch with us, info@acrepharmacy.co.uk, and then we can talk about different price books and things for yourselves as well, depending on how much usage you're getting in the clinic. But I'm glad you found this session really useful. Thank you so much, Brendan. It was a great explanation. I was thoroughly interested in your talk, and thanks so much everybody for attending.
My pleasure. Take care everyone, and I hope to see you guys soon.